Excellent. Okay, so welcome to all of you, and on behalf of the Dupuytren Society, and I'm very happy to see so many people here, and being myself a patient, I have to say I'm really happy that you all are interested in this subject and are working in researching and treating it, and I really appreciate that personally also. I would also like to thank the UMCG and specifically also Paul Werker for hosting and organizing this meeting, and also the Wenkebach Institute, which was extremely helpful in preparing the meeting here, and everything looks great. It beats expectations, I have to say. And I think I'll do this one. Yeah, magic works. Now, just a word on the Dupuytren Society, International Dupuytren Society, for those who haven't heard about this. It's a collaboration of patients and physicians, and it represents and supports patients all over the world, and it supports research, and those are the two major goals, is promoting research and supporting patients. We have a variety of country organizations, and this is the British Dupuytren Society, the Dupuytren Foundation in the USA, headed by Charlie Eaton, and the German Dupuytren Society, and the most recent addition, and I just learned that from David O'Gorman, thank you very much. 2 days ago, the Canadian Society was formally instituted, and those who are familiar with the process of establishing a non-profit organization in the US or Canada know that this is a hard way. Yeah, Charlie is familiar with that as well. And we are also working on establishing an Italian Dupuytren Society, and this is headed by Giorgio Pagiardi, and maybe you can tell us more on that in Milan next month. And you also see, I'm a patient, Anne is a patient, Paul is a patient, and on the other side we have Charlie as a physician, Ulrich as a physician, and Giorgio. So we have a good mix and a good collaboration, and that's why we really enjoy working together, and also established quite something in the recent years, because 10 years ago there wasn't anything in that direction. And that's one thing. The other thing that I wanted to add is we were really overwhelmed, as Paul indicated, by the number of papers, and I think we made a very good selection in presentations, but there's one area which is missing, to my opinion, and this is pathogenesis, and it's missing because we didn't get enough papers on that, but it's something which I think personally is very important, because it's the key understanding of the disease process. And so I thought I'd just, as a patient, I just throw in 2 ideas to trigger thoughts, and that's just food for thought. One is we have made considerable progress in genetics, in understanding the genetics of Dupuytren's disease, but we have the genes all over the body, and the disease is just on the palm of the hand, maybe on the foot, but essentially it's in the palm of the hand if it's Dupuytren's, and it's not at the elbow, it's not at my back. So the theory is, or what I would think is, any theory to trying to understand Dupuytren disease which does not include the normal constitution and the normal building of the hand and the normal use of the hand is probably misleading. So if you just focus on one aspect, it's not the full truth. So you have to understand how the hand is built up and how it's used to understand how the damage starts and the disease is starting. The other thing which I wanted to add, the Dupuytren cord And I brought some Dupuytrens with me, so if you if you want to see one, please see me in the break. The Dupuytren cord is really that thing that's plaguing you and that's hindering that you can stretch your finger, but maybe it's not the disease really. Maybe it's just reactive tissue. And there's quite some indication that when the finger is stiffened, the cords go away and they shrink and they more or less vanish. So maybe the cord is something like, let me say, like fever with a flu. If you have a flu and you have a strong fever, then it may be very inconvenient and even dangerous, but the fever is not the disease. The fever is a healthy reaction to the original infection. And maybe the cord is similar. It's just an idea. Maybe the cord is reactive tissue and the disease is starting elsewhere. So this is just an idea, but it might affect treatment ideas and further research. But I'm getting carried away, and therefore I hand over the stage to Charlie Eaton, the head of the Dupuytren Foundation, for further introduction.
Thanks, Wolfgang. Well, this is great to have such a big crowd here. I made the transition from being a hand surgeon who treated a lot of Dupuytren disease because, like Dr. Worker, I was introduced to percutaneous fasciotomy for Dupuytren disease and developed a large practice of Dupuytren patients based on that. But last year I also made a transition to being a Dupuytren patient. So it makes it, all politics are local, it makes it more interesting. Dupuytren disease is like a bridge. It's like a bridge that spans two very different continents. It's from cells to contracture, from genes to goniometers, from molecules to manus. It's like a big, complicated bridge. And it's so complicated that I don't think that there's any one person who can actually understand all of the aspects of Dupuytren disease in their real depth. There's not any hero out there who can do that. What patients with Dupuytren disease need is not a hero. What they need is a heroic team, diverse, innovative, persistent. And that team is actually in this room today. Dupuytren conferences of this caliber don't happen that often. And this is our opportunity. We should all take the extra effort to really seize today and tomorrow as an opportunity to meet, to build bridges between each other, to work to function as a team so that we can advance the progress of Dupuytren research and make real progress on Dupuytren disease during our lifetimes. This process can start now. It actually has already started. So let's go.
10 seconds for Wolfgang.
Just 10 seconds because I forgot something very important. The results of this meeting will be published as a book electronically and as a printed book, and all the authors will be asked to provide chapters to this book. So you can also will be able to read more detailed proceedings than the presentations here, and it might be interesting to have a look into that. Sorry.
Thank you.
Thank you.